1. Acrophobia, the fear of heights. This is one of the most common phobias out there. For some people, just being on a tall ladder or looking out the window of a high-rise building can trigger intense fear. So why are some of us terrified of heights? It all comes down to our survival instincts. Our brains are wired to keep us safe, and heights can pose a real danger. But for those with acrophobia, this fear is amplified, making it hard to enjoy activities like hiking or even crossing a bridge. 2. Arachnophobia, the fear of spiders. Even seeing a tiny spider can send some people into a panic. Why do spiders freak us out so much? Well, it's believed that this fear might be evolutionary. Our ancestors who avoided potentially venomous creatures were more likely to survive. Over time, this cautious approach has stuck with some of us, even though most spiders are harmless. 3. Claustrophobia, the fear of enclosed spaces. This can make places like elevators, tunnels, or crowded rooms feel unbearable. Claustrophobia is thought to be linked to our need for freedom and control. When we're in a tight space, we might feel trapped or helpless, which triggers our fight or flight response. 4. Ophidiophobia, the fear of snakes. Much like spiders, snakes have a reputation for being dangerous, which can heighten our fear of them. Interestingly, ophidiophobia is quite common across different cultures, suggesting it might be a deeply rooted survival mechanism. While not all snakes are dangerous, our brains tend to play it safe and steer clear. 5. Aviophobia, the fear of flying. For some, the thought of being thousands of feet in the air is just too much to handle. Flying is statistically one of the safest modes of transportation, but our fear of it can stem from the lack of control and the unfamiliar environment. Turbulence, takeoff, and landing can all trigger anxiety, making it hard to enjoy a flight. 6. Cynophobia, the fear of dogs, is another common one. Despite dogs being known as man's best friend, some people have a deep-seated fear of them. This fear can often stem from a negative experience with the dog, such as being bitten or chased. It can also be influenced by cultural factors and family attitudes toward dogs. 7. Astrophobia, the fear of thunder and lightning. Storms can be pretty intense, and for some people they are downright terrifying. This phobia is common in both humans and animals. The sudden, loud noises and bright flashes can trigger anxiety and panic. 8. Trypanophobia, the fear of injections, is a big one, especially for those who need regular medical care. This fear often starts in childhood and can be associated with the pain of the injection or a fear of needles. It's important for medical professionals to be aware of this phobia and help patients manage their anxiety. 9. Social phobia, the fear of social situations. It can make everyday interactions feel overwhelming. People with social phobia often worry about being judged or embarrassed in front of others. This can lead to avoiding social events and missing out on opportunities. 10. Mysophobia, the fear of germs, has become more common, especially with recent global health events. Those with mysophobia are excessively concerned with cleanliness and avoiding contamination. This fear can lead to obsessive cleaning and avoiding situations perceived as unsanitary. 11. Agoraphobia, the fear of open or crowded spaces. This can make it hard to go to places like malls, concerts, or even public transportation. Agoraphobia often develops after one or more panic attacks, leading people to avoid places where they feel they can't escape or get help. 12. Emetophobia, the fear of vomiting. This can include the fear of seeing others vomit or even hearing about it. People with emetophobia might avoid certain foods, places, or situations where they think vomiting might occur. It can be very disruptive to daily life. 13. Hypochondriasis, the fear of having a serious illness. Those with this phobia often misinterpret normal body sensations as signs of severe disease. This can lead to frequent doctor visits, excessive research on health conditions, and constant worry about health. 14. Nyctophobia, the fear of the dark, is common in children but can persist into adulthood. This fear often stems from the unknown and the inability to see what's around us. It can lead to difficulty sleeping and anxiety at night. 15. Glossophobia, the fear of public speaking, is one of the most common phobias. Many people feel nervous when speaking in front of others. This fear can stem from a fear of being judged, making mistakes, or being the center of attention. It's something many of us can relate to. 16. Nosocomophobia, the fear of hospitals. For some, just the thought of going to a hospital can cause severe anxiety. This fear can be related to past traumatic experiences, fear of illness, or fear of medical procedures. 17. Dentophobia, the fear of dentists. Many people feel anxious about dental visits. This fear can come from a bad experience at the dentist, fear of pain, or even the sounds and smells of a dental office. 18. Aquaphobia, the fear of water. This can make swimming or even being near water a frightening experience. This fear often develops from a traumatic water-related incident, such as a near-drowning experience. 19. Aerophobia, the fear of fresh air or drafts, is less common but can be very real for some people. This fear can be linked to anxiety about catching illnesses or experiencing discomfort from sudden temperature changes. 20. Trypophobia. Last but not least, we have trypophobia, the fear of holes. This can include clusters of small holes in objects like sponges or honeycombs. While not officially recognized as a phobia, many people report feeling uncomfortable or disgusted by patterns of small holes. It may be related to visual processing and evolutionary responses.